All right, now to some health news this morning as we navigate a post COVID world, right? The new Medicare Health Outcome Survey is going to offer valuable clues discovering better care. And this morning, Dr. Stephanie Copeland from WellMed, part of Optum, is joining us to talk more about this. Doctor, good morning. Thanks for joining us.
Good morning. Thanks for having me.
Yeah, so it's always so interesting to kind of get a pulse on where we're at and kind of how things are going. So I'm interested about this study. What did it find, doctor?
Well, Medicare uses several questions to rate the quality of healthcare that we receive. There are things like, how does your physical and mental health compare to 1 year ago? Is your doctor recommending that you increase physical activity? And if so, are you doing it? Are you managing urinary incontinence with your doctor? And if you are working with your doctor to prevent falls. So these are all great questions that we should ask ourselves, but also we should have a conversation with our doctor and see how we can work together to achieve our best health.
You know, what's so interesting is those questions are super important, I think, no matter what year or what's going on. But I'd imagine in this last year, it's even more important to make sure you're bringing these things up. What do you think this survey kind of has shown and that really needs to be done right now for those that are watching this morning?
I think it really has helped us to look at an inventory, right, post-COVID, especially in terms of mental health. We all know that mental health is an extremely important component of overall health. And, you know, we have found that about half of adults only get to receive mental health assistance from their providers. Of those that do get help, 60% comes from our primary care physician. So we really want to encourage everyone, find a primary care physician, visit with them, and ask them to screen you for mental health conditions like depression in the same exact way that they would screen you for blood pressure or diabetes, for example.
Well, and I was just going to bring that up too, chronic conditions as well. I mean, how are people dealing with those? What do we need to know about that?
Yes, with the chronic conditions in particular, it's so important to look at all of your options on how to care for yourself. One of those that many people aren't aware of are chronic special needs Medicare Advantage health plans. And these are special plans that allow for treatment of those chronic conditions, but also many people don't know may allow you to have a lower cost while you're doing that. So people can check out 1-800-Medicare, CMS.gov, or our website, wellmedhealthcare.com/bestcare to get more information.
You know, it's no surprise. It's always been like this, I think, no matter your age, but this can be a little overwhelming for people. We have about a minute left. What advice, what's your take home for those watching this morning, whether it's, you know, you yourself trying to find health care or a loved one looking after somebody and making sure they have what they need?
I think the number one thing is find your primary care physician. Visit with them even when you're not sick. Make sure you carry their info with you and share it with specialists that you visit in hospitals, because it really does take a team to keep you healthy. And we want everyone working together to take care of everyone in our community.
I love that. I don't know if I've ever heard a doctor say that. And I think that's brilliant advice of see a doctor even when you're not sick, right? That's when we tend to go, and then that's what you're focused on. So I love that. That's great advice. Doctor, thank you so much for your time. We appreciate We've been showing your website right there, and we'll make sure it gets on ours as well so it's easy for people to find.